scanning the room, doing a 360 view. And I'm going to come over here.
You're okay. All right, you ready? Okay, so I have already checked the physician's order against the patient's MAR, and everything is correct. I have the correct size catheter and all the supplies that I need inside the room, and I've verified that I'm here at the right time and doing it the way the physician wants it done. So now I'm going to go in and start the process and read our patient. Hello, how are you doing today? My name is Jody. I'm a nursing student at Northwestern, and I'm part of your healthcare team today. Today, I'm going to be inserting a Foley catheter, and I know that the physician has already been in to discuss the process with you and answer any questions, but I wanted to go ahead and give you the opportunity while we're getting started. If you have any questions or concerns, please feel free to stop me and ask, okay? If you could, please verify your name and date of birth for me. All right, perfect. Thank you, Mrs. Shelton. All right, now, I know you've also been asked this 1,000 times, but can you go ahead and let me know if you have any allergies? Okay, so no known allergies to latex, betadine, or adhesive? Okay, perfect. Okay, and you understand why we're doing the process today? Okay. And do I have your verbal permission to go ahead and get started and insert that Foley catheter for you? Okay. All right, great. So I'm going to go ahead and raise your head up to waist height for me, just so it's easier for me to work. I want to make sure that you're comfortable as well, though. Okay. I'm also going to come around this side before I lift you up. I'm going to let you up into a semi-sitting position. Now, for this catheter, I'm going to need you to bend your knees and lift your feet facing flat on the bed for me, about 2 feet apart. Can you do that, or do you need some help? No problem. I can help you do that. And I am going to put a sheet over you to provide some privacy, okay? Now, I have all the supplies that I need. It's just going to take me a minute to get everything set up, all right? Thank you. I've already sterilized the table, so this is already a sterile field. Now I'm going to go ahead and open up my packaging. To the outside of the package. Outside, making sure that I keep my fingers on the outside limit margin. I did outside, inside. Now I'm going to do this one. And then again, keeping my fingers on the very tip, I'm going to slide that there. I'm going to place my surgical gloves over here just so I have more of a workspace. I'm going to go ahead and put it back together since it fell apart because we're reusing these and we're kind of working on a time crunch. So I know that normally that would not happen. But just for the sake of time,
So I hope that's okay, Miss Hickman, because the security guard is waiting for us to be finished so that she can go home. And I know it's just because they've been used. We've been practicing with them. Okay, so they're back in the package and everything is back the way that it was. Okay, so I laid this out. Now I'm going to turn and do my gloves again. All right. So I would take my fingers along the underside of the packet, the paper, like this. Okay, and then I'm going to pull and pull and pull. Again, making sure that my fingers are always on the outside edge of that paper. All right, now with my non-dominant hand, I'm going to grab the cuff and glove my dominant hand, being sure not to touch the outside of the glove. Yes, Mrs. Shelton, the gloves are always the hardest part, especially for me. Now I know this glove is messed up, but that's okay, because once I get this glove on, then I can straighten it out. So now I'm going to go under the cuff, keeping my thumb out and making sure that I do not touch the inside cuff of the glove, and I'm going to glove my non-dominant hand. And it's okay for me to touch the outside of this glove, because sterile on sterile is good. All right, now let me fix this finger. Okay. All right, now we're ready to go. I'm gonna take this and drop it. All right, now I'm going to take this pad, since I have my sterile gloves on. I'm going to hold it like this along the outside edges again, and I'm going to protect my gloves as I go in, and I'm going to drop it, and then I'm going to adjust it so that I'm still maintaining my sterile field. This is for a male. Miss Shelton is not a male, so we're going to discard that. I'm going to take my box and turn it, also making sure that I'm still staying within the 1 inch margin. Okay. Go ahead and wrap my catheter. Dropping in the trash can. I'm going to pretend with this. I'm not actually going to insert the 10 mils of sterile water into the balloon. Okay, so that is done. Got my catheter tip here. I'm going to scoot everything over to make room for my lubricant. Okay, so here's my lubricant. Uncap it, squirt it down in there. Okay, I'm going to take the catheter tip 3 or so inches, and I'm going to get it all lubed all over without hitting myself or coming out of the sterile field. Okay, I'm going to leave that right there. All right, next thing I'm going to do, I'm going to remove this, and that's okay because we're not using it. And I'm just going to place it on the table because sterile on sterile is sterile still. All right, now I'm going to open my betadine, squirt it all over my cotton balls. Put that there, and again, dropping that. I'm going to put my lid. I'm going to take it, turn it. My catheter end, I'm going to put closest to my patient, still maintaining that 1 inch barrier all the way around my field. Okay? All right, Now, Mrs. Shelton, the first thing I'm going to do is clean so that we don't have to worry about running the risk of infection or anything for not cleaning you properly before we inserted your catheter. I've soaked the cotton balls in betadine solution, so it's going to feel a little cold. So please, please, please excuse me. I take my non-dominant hand, avoiding the sheet with my, pushing it back with my elbow. I'm going to spread out the labia. Now I'm going to take the cotton ball, trying to avoid dripping anything on the catheter. I'm going to clean the middle first. And drop. Go around this way. I'm going to clean this outer part away from me next. And drop. I'm going to go this way, not touching your leg, and clean this part. One stroke down, all the way around, and drop. Okay. Now I'm going to insert the catheter. Now, Ms. Shelton, this is not going to necessarily feel good, but it should not be painful. So if at any point it gets to be unbearably painful, I want you to let me know. I want you to take a deep breath in for me and then exhale it. And whenever you exhale, I want you to bear down like you're urinating, like you're going to potty, like you're going to pee, okay? All right, so take a deep breath in. All right, and let it out and bear down. Very good, very good. I'm going to insert it. And now I'm looking, and I do see there is urine in the tubing. So I am in the bladder. It is clear, and it is yellow. It's not cloudy. So now I'm gonna go ahead, since I've seen that urine, I'm gonna push in another inch or two, okay? And now, without releasing the labia, okay, I'm keeping that out. I'm going to go ahead and I'm going to inflate the balloon. Okay, you still doing okay, Miss Shelton? All right, perfect. All right, now I'm just gonna give it a light tug. I do feel that resistance, so the balloon is inflated and we're good. All right, Miss Shelton, so the hard part is over. You did great. All I'm gonna do now is I'm going to back away, all right? I'm going to tape the catheter to her leg. At this point, I would normally go ahead and take these gloves off and put other gloves on just because I feel better about that because I don't want to be touching her with lube all over my gloves. But for time purposes, again, I'm going to skip that part. All right, so I'm going to take the catheter. I'm going to tape it to her leg. And all while I'm taping it, I'm making sure that I'm leaving enough slack so that if she does have to get up to go to the bathroom, she has enough slack in her catheter that she's not going to pull it out. Sorry about that. This is Shelton. I use paper tape because in the hospital, more than likely, hopefully, we'll be using the adhesive pads to go with it or the strap. I've taped it. She's got plenty of slack. Now I'm going to take the bag and I'm going to hook it on the non-moving part of the bed. I'm going to, there's a hook right here. So I'm going to hook it right there, okay? Now I'm going to gather up this and get it out of the way. Drop. Drop. Go ahead and... Now, Mrs. Shelton, if at any point since we've done this, you start feeling a strong urge to go to the bathroom, like your bladder is full, and you don't see it draining into the tube,
I want you to use your call bell and let us know, all right? Also, whenever you get up to go to the bathroom, or if you get up to move around for any reason, not really for the bathroom, you shouldn't really need that because you have a catheter unless you have strip number 2, and that is perfectly fine. But whenever you go, you need to make sure that the bag stays below bladder level or waist level, and you don't want to drag it on the floor, okay? All right, I'm going to go ahead and put your side rails up. Are you comfortable? Are you good? I'm going to lower you down in just a second. All right, good. All right, I'm going to also take my pen. I'm going to label this bag with my name, the date, the time, so that people know that I'm the one who inserted the catheter, okay? All right. Side rails up. You did great. Hopefully, we will not have to leave that in there any longer than necessary, and we'll get to the bottom of why you're feeling bad and get you feeling better real soon. And did you want me to go ahead and lower your head too? All right, so the side rails are up. Your call bell is right there, Ms. Shelton. Please do not hesitate to call us if you need anything, okay? All right, thank you so much. You did great.